morning to everyone here. Okay, so this is my second run. Just now I did the Chinese version, so now this is the English version. Okay, so without any further delay, I will start the talk now. Today's topic is on role of traditional medicine, okay, mainly Chinese, in cancer care. Okay. I'm Ricky Ang. Okay, I'm a pharmacist here, but I also is a registered Chinese sensei. Okay. Today my stand here is mainly what I say here is trying to be very objective about Chinese medicine and objective about chemotherapy. Okay, that means it's not. I hope it doesn't sound biased, mean a fair statement. Okay, and today's topic also there won't be any diagnosis or to give any prescription. Meaning I won't tell you, okay, for this cancer you eat what or prescribe what medicine. But as a whole, maybe I'll just mention a few. Okay, and today my objective here is to increase awareness. What awareness? Increase mainly you are here today, right? To listen to this topic. Yeah, to know more about TCM and to know more about some of the possible side effects of TCM, and also if you combine TCM and chemotherapy together, right, what could be the possible consequences, okay, which you all may not be aware. So mainly this is my objective today. Today's content, okay, mainly give an overview of traditional medicine and how does it complement your chemo, and the possible potential means possible herb and drug interaction. Herb means the TCM, and the drug could be your chemotherapy. And also need to understand the side effects of the TCM. Alright. And lastly is the Q&A, the frequently asked question that I face day in, day out at my workplace here. Okay, so I guess you all know who this person is. This is Mr. Bean. Okay, he's forever happy man, smiling. So now he look a bit stunned. Why? Okay, of course all these are being fiction. They are fiction. Okay, so why does he look stunned? Because doctor has just told him that he has cancer. Okay, so he's stunned. Alright. So of course with cancer, then what he need to do next? To see an oncologist or to see a cancer specialist. So he see this doctor, and then this doctor say you have cancer, you need chemotherapy. Okay. Then well he think for a while, he consider. He say should I be having chemo or not? Okay. So he went to consult a Chinese sensei. And then Chinese sensei say, okay, this is in Chinese. I say, don't worry, you can use TCM. Don't worry, you can use TCM. Okay. So how? So doctor say cannot use TCM, but this sensei say can use TCM. So of course he is a bit confused, don't know what to do. And this is real in the sense that day in, day out, I come across many patients here at this place who need chemo, but at the same time they are also they seek TCM. Okay. So one of the most popular questions I've been asked, or my colleagues often ask me, is patient ask, can they take TCM together with chemo or not? Okay, this is the most popular question. Okay, so I will address this question later as the talk goes on. Okay, so let me give a very brief overview of what is traditional Chinese medicine. Basically, Chinese medicine is not as mystical, magical, like what some people think. Or sometimes, if you see a sensei, they will say, wow, many things, make it sound so complicated. Okay. Actually, basically, right, Chinese, the concept, right, we only look at, to put it very simply, we look at two things. The concept is yin and yang balance and various organs in harmony. Okay, yin and yang, is like the globe, the earth, we have day and night. Okay, when there's fire, there's water, So there's always this black and white, the opposite. So our body, right now, I'm well. Okay, I'm well. Why? Because my yin and yang is balanced now. Okay, with many people here who are well, the yin and yang is balanced. When your yin and yang is disturbed, that means your yin is less, or your yin is more, or your yang is less, or your yang is more. Okay, a person will be sick. Okay, so that's when sickness comes in. So what we do with TCM is we try to restore this yin and yang back in the body. So once this yin and yang once this yin and yang balance is being restored, right? So the person is well again. Another theory is the various organs. In our body, there are many organs, right? The heart, the liver, okay, in Chinese called 心肝脾肺肾, so it's heart, liver, 心肝脾, spleen, lung, and kidney, okay? So these are the main organs in our body that they are living in harmony, huh? Like Singapore, various religions, races, all live in harmony, okay? So, at any point of time, if one of the organs go haywire, say, commonly, your liver, say, your liver now becomes very, we say hitty lah, hitty. If your liver becomes hitty, what will the liver do? Your liver will tend to bully your spleen. Okay, tend to bully your spleen. So your spleen gets injured or get bullied. So now they are not living in harmony anymore. So you get sick. So again, we use TCM to restore, make them live in harmony. So once all these organs live in harmony again, we are well. Okay. So basically, we use TCM to adjust these two things, yin and yang, and the various organs. Okay. TCM is a very broad term lah. So it actually consists of mesotherapy or twin, how some of you you probably know. Qigong is one of them. Exercise, Tai Chi, all this. Sometimes we can also put them under TCM also lah. And this is acupuncture. Acupuncture is, I think most people know, 针灸. And this is 拔罐, 拔罐. This is what they do. You see, this is called bloodletting, 放血, bloodletting 拔罐. And this is Chinese medicine. Of course, today our main emphasis will be talking about this and food therapy. Food therapy means in Chinese called 食疗. I will talk more about these two lah, because these are the most things that most patients are more concerned with. So when, let's say somebody is diagnosed with cancer, go and consult a Chinese sensei, a Chinese physician. Sometimes the sensei will prescribe one whole list of Chinese herbs, maybe. Very often I see it's about 20 herbs, 20味药, 30味药, 20 to 30 herbs. Sometimes it comes in big bags of raw herbs, dried herbs. But now the modern days now is that it comes in all powder form. You tear, you mix, then you add water, then you drink. Okay. But what's inside the concoction or the formula? Basically, right, what you get of all the herbs, right, they consist mainly of these few categories lah. Okay, for those who can read Chinese, it's easier to understand. Okay, but I'll translate into English. So 清热解毒 means to clear the heat and toxins. Okay, 活血化瘀 means to invigorate the blood and remove stasis. 软坚散结 soften and disperse the lump. 以毒攻毒 is using poison to treat poison. 扶正培本 means to tonify the body lah, and others. Okay, so TCM concept of cancer is called cancer is like a growth, it's like a lump. So this lump can be due to toxin, can be due to blood clot, can be due to phlegm. Okay, but having said that, I must stress that this blood clot is not the English blood clot where you get heart attack or stroke. It's a different kind of blood clot. And the phlegm is a different kind of phlegm, where people cough, mucus, that kind of phlegm is a different concept. Okay, so we can use herbs to help clear the toxin, to move the blood, to disperse the lump, and using poison to treat poison. This is something like chemo, because chemo, as you know, is poisonous, lots of side effects. So sometimes you use certain poisonous herbs to treat cancer also. And one of these, last one is the tonify the body. Many times patients are very concerned because I will be having chemo, a lot of side effects, I will be weak, then how? Give me some tonic. This is the most common thing that patients always ask for. Sometimes even before the chemo start, they're already taking tonics already. Okay, so tonify the body to fight against the side effects or maybe the cancer. And some other medicine that you may find in the concoction is like move the qi or li qi, get rid of moisture or rid of water. Okay, li qi is often inside because sometimes when you have pain, we say that your qi is not moving. Or you have lousy appetite, your qi is not moving. So sometimes we add some of these herbs inside. Okay, so if we have 10 cancer patients here, let's say 10 breast cancer patients, all the medicine field will be different. You know why? Because sometimes, for some patients, we look at the tongue, we feel the pulse. Oh, this patient, okay, the liver is very heaty, or this one, very phlegmy. So it gives different kind of medicines. But in Western, it's different. Western, these 10 breast cancer patients, right? Maybe 10 of them will have the same chemo up front. You understand? So that's why Chinese medicine is this way. It doesn't mean who take already good, I will take the same formula from her. No, it doesn't work this way. Huh? It doesn't work this way. It's like a tailor-made thing. Huh?